Hey everyone, welcome back to the Diet Diaries. My computer was frozen there for a second. I have a guest today. I'm excited. You guys know I don't do many guest episodes. I'm here with Dr. Tawny Cross. She's a physical therapist based in North Carolina, but offers services virtually, which is awesome. And she specializes in chronic pain. And Tawny actually reached out to me. Um, to see if I might be interested in having a conversation with her. And I will share that I do get a good number of cold emails from people and I always read them. I only respond to a couple ones that are clearly written by a human maybe. Um but this is maybe only the second out of many where I was like, "Oh, this is really interesting." Because when Tawny reached out to me, she's like, "I think could we have a conversation around chronic pain and body image?" And I'm like, "Yep, we definitely can." It's not the first time that we've talked about this on the Diet Diaries, but once is never, and we need to hear these things many, many times. And everyone that comes on, or any guests, certainly have their own kind of perspective and experience. And so I'm really looking forward to this. And welcome, Tawny. Thank you for being here.
Awesome. Thank you for having me. And I'm very, very glad that you managed to find me amid all the cold emails you get.
Yeah, yeah, no, I mean, it's not that I get so many a day, but I get maybe one or two a week, and some of them are just so out of left field. And I'm like, what? No. And I'm like, oh wait, this one's actually interesting. So yeah, why don't we just get started? Can you share a little bit more specifically about what you do as a PT that specializes in chronic pain and why you do that? Like what was it about chronic pain that kind of drew you into that area of focus?
Yeah. So most of my career has been in a veterans hospital. Actually, all of my career. And I've been in the veterans hospital since 2013. And I think I want to say I was a little bit naive coming out of PT school. I was like, oh, yeah, just give stretches and exercises. Everybody will be better. And maybe that might be more true in a civilian population. In the civilian population, chronic pain happens to be 1 out of 5 people, generally speaking. Like that's the estimate that they give you. And then when I entered into the Veterans Hospital, the amount of chronic pain that you see is around 80-90% of the
Wow.
cases that you see. So, which is a lot, which you can imagine that if you're only equipped with stretches and exercises to help people strengthen or whatever, it leads you to have very unsuccessful interactions with people where people are feeling like they're still struggling. You see people cycling through the system, like nobody seems to be able to manage like chronic pain very well, at least insofar as like what I've seen since 2013. And so I had to do a lot of deep diving and exploring exactly what was going on, because it was either, just continue with what I'm doing and let those people like suck it up, or is there something that I'm missing? And so I started to dive more into things like nutrition. I dove into the science behind pain. I dove into clinical hypnosis. Oh my gosh, there's like so many things I actually looked into. And diet was actually one big thing that I thought in the beginning was like people talk so much about gut health and inflammation. So I was looking into things of that nature. But as I learned more about pain from different practices and different approaches over time, it truly became to be that it's all of those things, right? It can't just be
Hmm.
one thing. It's
Hmm.
all those things that weighing together that really help people change the trajectory of their lives. And when I started to look at more the whole person, the mind and the body and the gut, I started to be able to see some bigger changes with the people that were struggling so hard and like 20, 30, 40 years. Finally, they're starting to see some changes. And I was like, oh my gosh, that's so amazing. And so
Hmm.
that's how I got into my work. Really passionate about it. It's just like a cool area, difficult but really cool.
Yeah, yeah, that's awesome. Before I worked as a coach, I taught yoga and movement for 9 years and did, a lot of studying continuing ed around pain science and worked with
Mhm.
people, not to the extent of chronic pain that you work with, but really understanding, how multifactorial it is, right? And to your point, all the different pieces that are impacting it.
Mhm.
And yes, you can come and show up to a yoga class 2 or 3 times a week and do a private session and work on some things that help, but it's also about addressing all these other facets of your lifestyle and behaviors and all of that. Some things, parts of which are in our control, some things are not within our control, but it is as weird as it is to say this, pain is fascinating.
Yeah.
which is weird because it's like pain is, obviously debilitating and a terrible experience for pretty much everyone. But there's,
Mhm.
I think on the flip side, so much opportunity, right? When you really understand how it works.
Yeah, absolutely.
Yeah. So you work with, and in the veteran population, I'm going to make an assumption, but I'd love to hear, like, primarily men. Do you work with any women?
There are more and more women that I work with,
Mhm,
and I would say that has changed a little bit over time. In the beginning, I
mhm.
did see like 90% men, but I wanna say nowadays I see 70, maybe 60, 70% men and then 30, 40% women.
Oh, okay. That's a lot more than I would think.
Yeah.
Um, are there differences kind of in the way that chronic pain impacts the different populations based on
Yeah.
gender? I'm kind of asking.
Yes. So actually, the people that struggle with chronic pain conditions, that well, just in general, everybody struggle. Like you can find men and women that struggle with chronic pain, but I want to say that the statistics show that women tend to be higher in number in percentages, and some of this is hormone related. Some
Mhm,
of this is you might call this the patriarchal society,
mhm,
like how that impacts our person, our environment.
mhm,
Some of it is just also the perception that we're weaker, the perception that like we need to be able to deal with more pain. There's a lot of things that actually make it so that women tend to be a bigger percentage in the pain story.
That's so interesting. Right, I was just saying pain science is fascinating, right? Because
Yeah.
those are all like these intangible things that we can't control, these cultural, societal expectations, but that have a huge impact. Right. Of course, I'm going to make a link, right? Not unlike diet culture and the way these things impact how we perceive ourselves and the way we eat and how we think about food, all these intangibles that we've just grown up with, been raised with, that we take as point blank as like the sky is blue, the grass is green, right? We just
Mm.
internalize these things and accept them, right? And those are maybe not the best example, but meaning that we just kind of take these things at face value and live with them and don't necessarily think about the impact that they're having, right? Like I don't know that I would have thought about sort of the this concept that like women in general like are weaker, right? And so that would impact our experience of chronic pain. It makes total sense when you say it, but probably wouldn't have occurred to me.
Yeah, yeah. It's if I break it down to people on a more pain sciencey nervous system level thing, usually I say, "Hey, um, your nervous system is deciding between two things. Am I able to relax about this thing, or is this threatening information?"
Mhm.
And the perception that you're weaker, you're eating wrong, that you have to carry all this pressure around this, like of taking care of babies and also working and also being all
Mhm.
these things, um, or or simply if we were speaking about pain, that like pain means your body's broken. Like all those things are threatening information,
Mhm.
and being able to help people shift away from those ideas is like a huge part of the healing journey.
Mhm. So, like, what when you're working with, a patient, what I'm not gonna say what percentage, but what part of your work is like that? Like, the more, like, intangible pain science, how are you thinking about pain versus, like, the physical, like, the true physical of physical therapy?
The movement stuff,
Yeah.
the bread and butter of what I started my work
Right,
in.
right, what they teach you in PT
Yeah.
school.
I want to say nowadays it's like 90% intangible and then 10% physical movement. And I
That's
sometimes like to
interesting.
integrate the intangible stuff with the physical because that actually makes for a more powerful experience, just because we learn by body
Mhm.
experience.
Mhm.
But a lot of my not pain specializing PTs that watch me, they're like, "What do you even do nowadays?"
I
They're
just
like,
talk to people.
I just talk to people. But yeah, there's still movement in there. I want to say that the practice is tends to be fairly integrative, and
Mhm.
as being a PT, it gives me ability to look into how much of someone's pain experience is something I need to look at on a tissue based level, a
Mhm.
biomechanical level,
Right,
versus looking at it in terms of like what are your social, environmental, psychological factors,
right,
nutritional factors that they look at.
right. So as I'm listening to you, it's fascinating to me that the shift is like 90% the intangible and 10% like kind of like the tactile physical stuff.
Mhm.
but it's really making me think about, right, and not because this is what, like, we had talking about, but, like, body image and how it's so intangible, right? It's like the perception that we have about how we look and the feelings we have about what we look like, and how that's kind of all worth it, how we have to go through a lot in our head as compared to, like, the tangible piece of things, which is like, what's the food I'm eating? How much am I eating?
Mhm.
You know, I'm like kind of like losing my point and what I wanted to say here, but that there's kind of this emotional, mental, intangible component, and then there's like these sort of tactile, tangible skills,
Mhm.
and that work with body image. And I actually never really thought about it this way before. Feels like it has a lot of parallels in terms of like working with chronic pain and the way those two things are impacting
Mhm.
a person's ability to kind of like show up and move through the world.
Yeah, absolutely. The way that I want people to understand that, like, the mind and the body are they're not even roommates, they're, like, the same thing
Yeah,
almost, right?
yeah.
Because people wanna separate those 2 things when in reality, they're inseparable. Like, if you're feeling trouble, like, seeing something physically, there's also a mind component, an emotional component that goes into, like, why, like, that, why you're experiencing those struggles.
Mhm.
Um, and I think I'm losing my train of thought just like you did.
I know it happens all the time.
But yeah, it's very intricately linked,
Yes.
and the more that you can see that link,
Mhm.
the more that you can start to separate, like, what is physically something that I need to work on, and what is something
Yes.
that, like, is
Yeah.
yeah.
Yeah. Like when I work on body image with a client, and this is something I've also personally experienced, talking about like, well, what does your body do for you? What are some of its functions? What does it allow you to do? I think is a really interesting way to connect or to help someone realize that connection between the mind and body, and that it is like kind of one and the same, right? That you can, for instance, strength train and pick up a heavy weight and feel like the capability that your body has and feel that vitality and feel that strength. And then that starts to kind of translate and shift the way you think about your body, not just as like a thing to be looked at, but as an
Mhm.
actual like body that has a purpose, like
Yeah,
really
yeah.
what it is. Um, but I think in terms of your point around like the mind body, and I've heard some people refer to it as also like the body mind, like one word,
Mhm.
right? Not like
Yep,
the mind body
exactly.
connection, but like literally mind body, no space between the D and the B, right? It's
Yes.
one thing.
Mhm.
Um, is not something that most people are used to thinking about, especially because like mind body connection has been like this. It's like now this like colloquialism I feel like that people just talk about. But,
Mhm.
really just kind of, I just, that example just came to mind is like, oh, that's, you know, how I would kind of take that concept and apply it in terms of body image, right? That where you're the way you're talking about it as a tool in terms of
Mhm.
how to deal with chronic pain.
Yeah, yeah. And that is a lot of, like, the way that we talk about things developmentally is actually the
Mhm,
body and, like, the very raw parts of the mind grow
mhm,
first before
mhm.
we develop these, like, huge, bigger, rational, logical thinking pieces.
Yeah,
And we truly do learn by, like, body experience. Like, our posture is informed by, like, our moods. Our posture is informed by, like, what our parents told us when we were younger, like, what is, like, good or not good. And
yeah,
obviously, we don't wanna use those words. I'm putting quotation marks for people who can't
yes,
see.
yes,
But yeah, like, our body really truly informs what our mind learns.
yeah. I like an easy example that people talk about all the time is like, butterflies in your stomach, right? When you get excited or nervous to meet someone or to take a test or whatever, and you feel that physically. Or
Mhm.
if you get anxious, something is causing anxiety and you feel your heart racing, right? There's all these, I mean, lots of connections between what's happening in your mind. I mean, a panic attack is an unfortunate experience, but a great example of the physical manifestations of what's happening in your mind. And they are not, you can't separate those things. They are
Mhm.
happening like in lockstep at the same time, and one is constantly kind of like feeding or fueling the other. Um,
Yeah. Yeah. There's
yeah.
there's I think also research examples where if you tilt backward in space, you're actually likely to think more about the past, and if you tilt forward in space, you think about the future, which is, like, super fascinating to
So
me.
interesting. Oh my god, like, I love this stuff. It's like I've been fascinated by the human body since I was a kid.
Mhm.
Um, and now, like, as my work has transitioned more into like coaching and skills and behavior change and what, like the psychology piece of things is just fascinating.
Yeah.
Um, so what is, like, as we're kind of talking about pain science and body image, what has been your experience? Um, and I guess with men, I mean, primarily our listeners are women, and I work with women, but we don't have to only speak about women because you're working
Mhm.
with, both men and women. Um, what has been your experience with a link or a connection between someone who is living with chronic pain and their body image, meaning like how they feel about how their body looks, how they feel about how their body functions? Um,
Mhm. Yeah. I would say it is a very strong, if I had to give a percentage, like 90% link. If you believe your body's broken, if you
mhm,
believe that you have a quote bad back, if you have a weak core, if you're the
mhm,
tightest person in the world, the
mhm.
least flexible, unfortunately, sometimes the providers actually lend you to think about these things too. They're like, "Oh my
Yeah.
gosh, you've got like the worst looking spine I've ever had. You need to lose
Yep.
weight." You know, like if you're overweight and if you just lose weight, then like you'll feel so much better about yourself. Your pain will be
Yes.
gone. And that is unfortunately like it's probably the beginning foundation of some of the work that I do with people, like helping them
Mhm.
unwind that, be like, actually, like we want to challenge this because while like the physical stuff is something we want to consider, it's the worry, it's the pressure, it's the stress of trying to maintain this image of like I have to be a skinny person or I have to be a strong heavy weightlifter in order for me to not have pain, when in reality, you know, like what's his name? Ronnie Goldman, the guy who was like the like weightlifter, like he has incredible amounts of pain and he was like lifting super heavy. Certainly wasn't quote a weak person. And you
Mhm.
have so many examples of people who are a different shapes and sizes and they have pain. So we want to remember that like what the doctors are saying, we have ability to challenge that, right? We don't have to accept everything that they say with like um as if they were gold.
Yes. Yeah, I think what you mentioned about the language that is used, and to your point, and you kind of like called out your own profession, that like so much comes from the medical profession in terms of like the language that's used that then impacts how people feel, right? Like you, great example. Well, two that you said. One, which you weren't actually saying, is that like a PT or a doctor would say. So maybe that's like a separate thing. But that was the idea of like, oh, I have a bad back, I have a bad knee. So maybe we can talk about that a bit separately, but more in the realm of like, oh, you need to lose weight. If you lose 20 pounds, that'll fix your knees. You're just carrying too much weight around on your knees, right? And that will
Mhm.
fix everything. And then so you say this, not you, but someone else, right, says this to a patient, to a client, and then they leave with not only no resources or support or skills with which to pursue this directive that the doctor or the PT or whatever has just given to them, but
Mhm.
also has that medical professional taken any consideration into that person's history with weight loss or eating or body image, right? So it's
Mhm.
like people are looked at as silos, as just like a parts that are connected by skin and bones and connective tissue, not
Yeah.
as like I always talk about the human body as an ecosystem. What's
Yeah,
happening
absolutely.
down in your toe is affecting what's happening up on your head and vice versa. Oversimplified, but that's kind of the point. Um, and it's so, I hear this from clients all the time. So many people come to me, my doctor told me I need to lose weight. My doctor told me I need to lose weight.
Yep.
And the doctors just say this, like, well, just eat more, eat less and exercise more. And it's like, do you not realize you're fueling like another generation of disordered eating? So anyway, just to come back to the circle back to the point of the language that is used and the
Mhm.
assumptions that we make around all of this plays such a huge role in that, kind of mind body relationship and in our ability in the way that we kind of think about our bodies.
Mhm. Yeah. And I think, like I think it's partially because the way that doctors are taught or providers are taught, like
Yeah.
you learn this stuff and
Right.
then you assume, okay, like I just say this and you don't realize you're causing any harm
It's
even though you are.
unintentional. Yeah.
Um, and we wanna realize that, like, um, when it comes to something like the way that you're saying these things, you're often placing judgment and shame, into those words, whether or not you're realizing it. like you're saying, this is on you. You
Yes.
lose the weight, you eat too much, or like you're the one who doesn't exercise enough. And when in reality, like people like people want to get better. Like they don't want to like sit there and like do
Mhm.
nothing.
Mhm.
And so I think it's so important nowadays to they do it some of it, not as much as I think they need to. Like teaching doctors like how to actually interact with patients and realizing like their words and how they phrase things
Mhm.
totally matters.
Mhm. So when people come into you, when patients come into you, do you find that they are walking in with some of those experiences as like baggage, for lack of a better term, that you're now having to kind of undo things that either other PTs or doctors want to have said to them that's impacting their chronic pain, and then the way that they are kind of connecting to and seeing their body?
Yeah, that would be one of the number one things I use as a way to help validate the person and
Mhm.
also connect with them is just like your pain is real and you've been told a lot of unkind and unhelpful things by
Mhm.
doctors and like not wanting to blame anybody, but like and these things don't serve you and they're not true. And we want to start to realize that to help you heal, one, pain is always real, and then two, some of the way that your system, your body or your person feels emotionally loaded might
Mhm.
be impacting that pain experience.
Mhm. Yeah, I was curious, and you just started to get into it a little bit, but maybe we can talk about it a bit more. Like, for someone who you are kind of seeing a very, I guess, overt connection between their chronic pain and the way that is impacting their body image, the way they talk about their body, the way they talk about their appearance. How do you approach that? I'm kind of thinking even in terms of like people who might be listening who are dealing with chronic pain, right? Like, are
Mhm.
there any kind of takeaways or things that they could start to pay attention to or notice based on the way that you work with people that might be helpful?
Yeah, like a very simple thing is just to be aware because, like, typically speaking, if because the physical and emotional pathways are so
Mhm.
tied, and if you notice like stress increases your pain, which is very, very common,
Mhm.
the stress of your body image, like, just pay attention. If you're noticing, you're saying to yourself something like unkind, like, oh gosh, like I'm overweight or something,
Mhm.
just notice for a second how that makes your body feel, either
Mhm.
on an emotional or physical level. Is it giving you more stress or is it giving you less? And if
Mhm.
it's giving you more stress, chances are it actually might heighten or make that pain experience a little bit more amplified.
Okay. Right. So just like paying attention, kind of like a little bit of like a notice and name process.
Hmm.
Good.
Yeah.
Got it. So you mentioned, so you work with veterans in North Carolina, but you mentioned that you also work virtually. Is that like separate from your work with veterans?
Yeah. I have a business that I don't think anybody that I've ever worked with virtually has been local. I have people from California to Australia.
Okay.
Um, so that's always kind of a fun thing, like just juggling the time zones. But yeah, like
Yeah. Yeah.
it's really amazing to see um just nowadays what like Zoom or those virtual meetings can do for you and allow and people I think people sometimes get like leery about being in a virtual space. Like, how much can you do for me if it's all
Mhm.
virtual?
Yeah.
And in reality, there's so much you can do on to help with pain. And you can still actually do physical stuff with virtual meetings.
So the patients you're working with virtually are the same chronic pain patients,
They're women, but yes,
women.
they're
Okay.
not veterans.
Okay. So, I guess kind of, coming back to, and we've talked a little bit about this, but um, you had mentioned kind of upfront when you sort of got into this area that you were looking at the way nutrition impacted things, the way diet impacted things. I'm
Mhm.
curious as to like as you work, I guess either with your veteran populations or your, I guess private client base, I'll call it. Um, do you observe or what do you notice or what has worked in terms of the role of food, the role of nutrition with the chronic pain piece, with I guess really with the chronic pain piece, like in the people that you're working with?
Yeah. So I actually, when I first explored outside of more PT related areas, diving into nutrition was one of the very first things. And I think learning in the nutrition approaches to chronic pain. Number one thing, I was like, okay, it's not definitely not about like the information, right? Just
Mhm.
teaching you, okay, you need to eat this and you
Right.
need to eat that, and this would be good for you. Even though if you're looking at the research end of things, obviously that is true. Like you see that anti-inflammatory foods can be really helpful for your gut and can help with inflammation and pain. Because what really happened when I started to talk about these things with people were that people had a general sense of like what was helpful and not helpful to eat, and they were struggling with the doing, and that
Mhm.
related to their emotional, their mental, the body image stuff.
Mhm.
As an example of this, I had someone who really wanted to do hypnosis around food. She's like, just give me something like put me in a trance so that I don't crave food anymore. And I was like, I don't know that this would be the best way to go. And she was just like, no, just I think this will be helpful. And I'm like, okay. So I started to put her, I talked to her through like a hypnotic kind of induction is what they call it.
Mhm.
And then I started to mention about like helping her shift cravings. And then she grabbed my arm and she said, stop. And I looked at her and I'm like, what's going on? She goes, I don't want to do this. And I had a feeling this was going to come up because I knew her a little bit more. Um, I had been working with her for several months, and she goes, I don't want to actually stop my cravings. And I
Interesting.
nodded my head, and she said, it's because I feel like I don't have anything else good in my life. If I take away food, what else do I have?
Mhm.
And so like it was like that type of interaction people where I realized, it's not just I can't give you, nutritional information, say don't do this and don't do that. And when in
Yes.
reality you've got so many layers underneath that
Yes.
it's making this relationship with food difficult.
Yes, that's so interesting. As you were saying that, I was like, I think I had a feeling that you were gonna say something along that space where she was, like, afraid to not have that, right? That there's this
Mhm.
safety, this protection that the food is giving you.
Mhm.
Um, yeah, and just, thinking about all the ways and then which that connects back to how you feel in your body. Like, when I talk with clients about these thought patterns and behaviors that we do, very similar to pain, like their protection, right?
Mhm.
They might be old, they're conditioned based on a lifetime of experiences, based on society and culture and expectations and all that, but it's
Mhm.
all coming from a place of protection. And it's
Mhm.
recognizing, like, when we restrict food, we try to diet, like we're trying to protect ourselves from being in an uncomfortable place, from being in a body that we don't know necessarily how to be in, or be in a body that society has told us is not okay,
Right.
or because it makes us feel like we're in control. And
Yeah.
starting to like recognize kind of why we're doing these things is really what makes the connection to, like, to your point, like, most people know what we're supposed to do in terms of food, right? We know the difference between, like, eating something nutritious for breakfast and, eating pizza every morning for breakfast. It's like, well, how do I do that, right? And it's like, how do
Mhm.
we close that gap?
Mhm.
Um, and that's really where, I mean, it makes sense, like, why 90% of your work is spent kind of working with people on the more intangible pieces behind pain. And it's the same thing with like the behavior. It's like, well, how do we start to shift that? It's not just saying, oh, just go cook a bunch of grilled chicken every Sunday and meal prep all week. It's like, yeah, well, I know that I should do that. And again, air
Mhm.
quotes around the should.
Mhm.
Why am I not doing that? And kind of uncovering and digging beneath that and helping people kind of close the gaps between what I know I need to do and what would actually benefit me, and like making it happen.
Right. And I think also people don't realize that the stress element, not only one, impairs the gut system to actually behave in a way that is like
Mhm,
what it was designed for. The stress system also makes you want to eat foods that are highly rewarding, which is
mhm.
why it's so you want to go beyond like just the food pieces and look into the stressors.
Yes. Yeah, absolutely. Stress plays a huge role in our ability to make thoughtful choices and be intentional, and it can really make people feel out of control.
Yeah, for
Yeah.
sure.
Um, what else do you feel like might be helpful to share in terms of the work that you do as it relates to anything related to food or body image, diet culture, eating habits, anything like that?
Oh gosh, I feel like there's like so many things that we we could talk about. I'm sure this conversation would go on forever if we let it. Um, I would say number one, if I had to like order things, I would say if you start to looking at addressing the stress rather than reducing stress, because I
Mhm.
think sometimes people get into this idea like if I just reduce my stress and then they're like, but I feel like I'm always in stress. I'm like, yeah, if like you can't always can't like really reduce stress like it
Mhm.
exists. It's your ability to be able to meet those stressors
Mhm.
and navigate through them. It's your skills in being able to regulate your nervous system through those things that actually help you. And then when you start to be able to have those skill sets, when you look into some of the mindset, the emotional work, that will enable you to be more successful in reaching like the tangible outcomes, which is why like, you and
Yeah.
I probably do so much more like the underground work because
Yeah.
like the surface stuff is easy. Um, well, looks easy, but you have to tackle the underground stuff first.
Yes. Yeah. It's so funny how you talked about not reducing stress, but looking at how to kind of manage it and work with it. I hate when people say like, yeah, just like reduce your stress. You can't eliminate your job. You can't eliminate like when your kid is homesick. You can't eliminate deadlines. You can't eliminate bills. Like that's life. It's about how do I navigate this? How do I cope with this? How do I move through it in a, better way? Better is not the best word, but in a way that's not, impacting me as much as it is in terms of like the pain might be, or the way that I'm using food, or relying on these different pieces, but really learning those skills of how to, I guess, cope with it, but feel more confident to deal with it instead of like just like I'm like less like this is happening to me and more I can like work through this a little bit more of like that kind of empowered, proactive
Hmm.
approach. But
Yeah.
yeah, just that switch of like, it's not about getting rid of stress because that's not going to happen. It's more about how can I learn how to better deal with it, or more effectively, I should say, deal with it.
Yeah. I think a good example of this is like I don't want to bring my husband in this, but I'm going to.
That's fine.
Like is the way that like my husband and I think differently. Like if I'm given a task, let's say I have to pack for a thing ahead of me, like some sort of travel event. He and I behave completely differently. For me, it feels manageable because it's one task. The way that I think about it emotionally, like meet this thing, it feels really easy. But
Mhm.
then like he tends to have more of like, what if this happens? What if this happens? What if this happens? What if this? And so essentially he's like holding 20 different futures
Uh-huh.
and trying to plan for all of those things, which makes it like this huge overwhelming experience and like
Yes.
might lead to anxiety. And so we want to recognize there's external pressure and then there's what we can actually regulate. Like can we see this thing differently? Can we change the way that this internal pressure is is to my system?
Yes. Yes. Right. Again, like having an awareness of noticing your tendencies and the stories that your brain is telling you, recognize that that's happening, and being able to like separate a little bit that from kind of your autonomy and your ability to make like a thoughtful choice that's in alignment with the action you need to take and what's going to feel good for you.
Yeah,
Yeah.
for sure.
Anything else that's like top of mind that you wanted to share or talk through, or that, would be, I think I already asked you this, but like that would be helpful for anyone listening?
Um, just like I think it would be just really helpful to re-emphasize that it doesn't matter your shape or your body,
Hmm.
like to know that one, like you can be, quote overweight, unquote.
Hmm.
And just for people that are listening, BMI is again something that people like is a rough guideline
Hmm.
and that
Yes.
doesn't really dictate everything
Yep.
that you are in terms of health. Um, but that what your body looks like doesn't correlate very well with pain. And then two, what is true is that with people who do have chronic pain or let's say relationship with food issues, there's actually a very strong mind body disconnection,
Mhm.
meaning that your body is it's altered in what it looks like to you. And this can come out in very obvious ways like body dysmorphia.
Mhm.
And it can come out in really, really subtle ways. Like if you have chronic pain, for instance, and I were to poke around on your back and to draw like a letter in your back, if I drew the letter A in an area of pain, you may
Mhm,
not actually be able to tell what I'm drawing because
mhm,
your mind body disconnection is so big.
mhm,
So there's some really fascinating things about like mind body disconnection, and truly like the healing space comes with learning how to realign your mind and body so that they're actually working
mhm,
together, integrating those things.
mhm. Yeah. Um, so when you were just talking about the like, if you were to like draw a letter on someone's back that was in chronic pain, in that area of pain, they wouldn't be able to kind of feel that or identify it. And that someone who experiences that might be more likely or more susceptible to have more of a disconnect in terms of like their relationship with food, in terms of how food impacts them, how they feel about food.
Yeah.
Okay, interesting.
And I mean, and I don't know that that's like necessarily like a high percentage, but like the what we see consistently in the research is that when you have a strong mind body disconnection,
Mhm,
you also have gut issues, more mental health issues,
mhm,
more depression, more
mhm,
body image
mhm.
likelihood. And the people, there's a strong, people who've had eating disorders, let's say at the beginning of their lives, are more likely people who have chronic pain in the future.
Interesting. Okay. So it's really about there's like this umbrella over all these things, right? Of that mind body connection and working
Mhm.
on skills and tools and getting support to work with that can then kind of have like this like trickle down domino
Mhm.
effect to impact things. Right. And that's why like the work that you do is so interesting in that, right? 10% kind of physical, 90% more, I'll call it mental to like generalize. To me, then there's such a carryover of that mental piece to all these other facets, right? It's not just like, yes, the pain is what's bringing someone in and what you're working on. But then I would imagine they become other skills that help you kind of manage and deal with this disconnect or rebuilding that mind body connection that impacts all these other parts of your life.
Yeah, yeah, and I think you use the word I like to use earlier, like ecosystem. Like it's
Hmm.
essentially like this beautiful connecting ecosystem,
Yeah.
and the way that Jordana you just said it is hopefully encouraging rather than overwhelming, because
Hmm.
sometimes people are just like, but I feel like I've got to like to plug all these holes and work on all these different areas,
Yes.
and in reality there is carryover. Like you a
Yep.
small one small change in one small area will actually affect multiple areas in your body's ecosystem.
Yes. And I actually find that so much in the coaching work I do where a woman will come in and we'll be working on challenges or relationship with food. And then a couple months into our work, she'll say, like, I'm noticing that my behavior in other parts of my life is different. I'm setting more boundaries with people. I'm being more assertive. I'm speaking up for myself. I'm speaking
Mhm.
to myself more kindly, all these different pieces. And it's like, oh my God. It's like the carryover from these things again is so profound and so real that I think the point you made is so important. It's not it I mean it can feel overwhelming, but it doesn't need to be because you can work on one area and then it kind of inherently and intrinsically spreads out from there to other areas of your life that need that support.
Yeah,
Yeah.
that is exactly right.
Awesome. Awesome. That's like I feel like a perfect ending point. Can you share how people can connect with you, learn more about the work that you do and the services that you offer?
Sure. I'm most active on Instagram. Um, in fact, if you wanted to have a mind body awareness meditation, just message me like mind body awareness meditation, and I will send that right over to you. But
Awesome.
yeah, find me on Instagram. It's you should probably have it in your show notes, I'm assuming.
I will. Yeah.
But it's because I'm like I have so many periods.
Yeah.
Dr period Tawny dot Kross cross.
Okay. Yeah, it'll be in the show notes so people will be able to find it easily. And thank you for offering that. That sounds awesome. I might take you up on that myself.
You're welcome.
Awesome. It was so nice to meet you and I'm just really appreciate your time and all of your insight.
I super duper appreciate you having me on.